This is a preamble you are going to use throughout your presentation for all performing stations in OSCE. Hello, I'm going to talk to you about a three-step approach when it comes to your OSCE station. The three-step approach is going to be used for all your performing stations during your OSCE. This structure will help you grasp every station very easily because this three-step approach is going to be used throughout your performing station on your OSCE day. With the three-step approach, you can either get a community setting or a hospital setting. So this demonstration goes with the hospital setting scenario. If you get a hospital setting, that is how you are going to go about with your OSCE presentation for the three-step approach. We are going to do community setting in the next video. The step one, when we talk of the three-step approach, it is about the preamble you are going to use to talk to the patient. When you go to the patient, what you are supposed to say and what to expect as well in general. Because all the performing stations, you are going to use this three-step approach. With the step one, it deals with checking for scene safety, ensuring privacy, performing your hand hygiene, and introducing yourself to the patient. That is what the step one goes about. So in step one, you go ahead to check for scene safety, provide privacy, and then introduce yourself to the patient, ask your patient's details as well, and confirm the biodata of your patient is accurate, and also confirm that you are actually dealing with the right patient. This is going to be the step one. And then the step two deals with what you are actually going to do on that station. So let's say in pain assessment, what entails in a pain assessment? When it comes to administration of inhaled medication, what entails in administration of inhaled medication? So that is the step two. And then the step three is going to be your closing statement. So this is a preamble you are going to use throughout your presentation for all performing stations in OSCE. So stay tuned and let's dive deeper. With the step one, this is how you are going to go about it. I can confirm the scene is safe. I'll provide privacy and dignity. I'll perform my hand hygiene following 7 steps of WHO guidelines. I'll pour an apple of joy in my palm. I'm going to rub palm to palm, palm over dorsum, fingers interlaced, fingers interlocked, rotation of the thumb, tips of the fingers, rotation of the wrist. I will leave my hands to dry for 30 seconds. Hello, good morning. My name is Oba Priam. You're attending us for today. Can you please confirm your name, date of birth, whilst I cross-check with my documents and your wristband? Right. Araba Lawson, date of birth is 10th March 1945. All right, I can confirm I'm with the right patient. How would you prefer I call you? All right, Araba, do you have any allergies? And if yes, what are your reactions? You don't have any allergies. Okay, I will note that. Araba, I'm here to conduct an A to E assessment on you. Is it the right time and are you happy I proceed? Before that, are you comfortable or are you in any pain? You are comfortable. Okay, thank you very much. I'm going to leave you with a call bell and go and gather my articles and come. If you need me, please use this call bell and I'll get back to you. Is that okay? Thank you very much. So you leave the scene and go and pick your articles. In some stations, you will not leave the scene, like pain assessment, VIP and IV flash for nurses. As soon as you seek consent, you are going to go straight ahead to perform the stations. But in other stations, you have to leave the scene, go and validate your prescription, validate your articles that you are going to use for the station before you come back to the patient. This is how the step one looks like. General overview, the first thing you are going to do is to ensure scene is safe. The next thing is promoting privacy and dignity. And then you are going to do is to perform your hand hygiene. You can either choose to verbalize the hand hygiene as a whole for the 7 steps of WHO guidelines, or you can act appropriately. And then you are done. I'll leave my hands to dry for 30 seconds and you go ahead. Watch my previous video about the hand hygiene. As soon as you finish your hand hygiene, you are going to approach the patient with the document at hand. So mainly during your OSCE, you'll be given a documentation or your scenario will be given to you on a paper. You have to go straight ahead with that paper and then talk to the patient. That paper has the patient's biodata, patient's allergies. It has every detail that there is about the patient. You need to make sure to confirm that you are dealing with the right patient. That is how you go about it. You introduce yourself. My name is Obapre. I'm going to be your attending nurse for today, your attending nurse associate for today, your midwife for today, however possible. And then you go straight ahead to ask your patient, can you please confirm your name, date of birth whilst I cross-check with my documents and your wristband. Then you confirm that, ask them about their allergies, are they comfortable, and then you seek consent. You tell them the reason why you are there. I'm here to administer your prescribed inhaled medication. Is it the right time and are you happy I proceed? That is gaining consent. And the patient will tell you, yes, I'm happy. All right, then I'm going to gather my articles and come back to perform the procedure. If you need me, kindly ring and I will attend to you. This is how you go about it. And as soon as you finish that, you are going to leave the scene, go and gather your articles from that side. Mind you, during the OSCE station, that room is literally going to have the patient bed on one side, your assessor on the other side, and then the other side will probably be your articles that you are going to use for the procedure. So all you need to do is to turn like this, turn that way, and then you are literally going to get access to everything. Maybe facing your patient will be this way, your assessor will be behind you, the camera is going to be on you, you turn and then you literally get access to your articles. This is how the performing station look like for the step 1. And then the step 2, as I said before, deals with the actual skill of the station. The actual skill means that what exactly are you going to do in that station? If it's administration of inhaled medication, what am I going to do in that station? That is what the step 2 is going to be about. And then we proceed to step 3 because we have finished step 1. We have gone back to pick our articles. We have come to perform the procedure. Now we go to step 3. In step 3, what are we going to do? Step 3 is the closing statement. You have finished your procedure. How best are you supposed to close professionally? That is the step 3. In closing statement, you identify that if the patient has any concerns, they can ask you, and also you perform your hand hygiene, acknowledge that you leave them with a call bell and document appropriately. So this is how you are going to do the step 3. Araba, I'm done with the procedure now. Do you have any question or any concerns for me? No, I'm okay. Okay. All right. Thank you very much. I'm going to leave you with this call bell. If you need me, kindly ring and I will attend to you. Is that okay? All right. Thank you very much. Going to discard my articles, clean my tray and make it ready for the next use. And I'm going to perform my hand hygiene. Hand hygiene is performed before you go to the patient, as soon as you leave the patient at all times. So note that. In closing statement, you ask the patient if they have questions, if they are comfortable. If they are not, you give them any reassurance that they deserve. And also if they have any questions, you are going to tell them. In some closing statements, you would have to offer education to the patient because sometimes, some station, you might want to say some things to the patient. Let's say with intramuscular injection for nurses, you are going to tell the patient, I'm done with the procedure. Please apply a gentle pressure on the site and do not massage. That is part of the education you are going to give the patient. If you are going to do blood glucose monitoring as part of your clinical stations, what are you going to say as part of your education? After checking the patient blood sugar, you notice that the patient blood sugar is high. What are you going to do? You tell them to hydrate. It depends on the station you are going to do. That will actually imply on the education you are going to give the patient. Generally, you ask the patient if they have any question or any concerns, ask them if they are comfortable, offer education appropriately. If the station has any education that is attached to it, offer them the education that they need. The next thing you are going to do is to verbalize that you are going to give them the call bell for anything. So you give the call bell and then you go ahead to discard your articles, clean your tray and make it ready for the next use. That is the 3-step approach. Learn this for your OSCE preparation, and throughout your performing station, you are going to use this 3-step approach, and this will help you because at the end of the day, everything you are going to say about the patient or everything you are going to do for the patient on each station, when it comes to being performing station, you are going to begin with the step 1. So memorize or practice the step 1, which is going to be your first preamble you are going to use. And then when you learn the station, you will learn the step 2. That is the actual demonstration of the skill of that station. That is step 2. And then you add the closing statement. So this is how you are going to pass your OSCE very easily. As simple as possible. Make sure to learn the step 1 and step 3, and then you combine it together. When you learn every skill, you combine the step 2 together and flow appropriately. Thank you for watching this video. Don't forget to comment, share to your OSCE buddies, and subscribe if you haven't. Click on the notification button so that it will enable you to be aware of the next video I'm going to post, and then we all learn together. Thank you, and let's pass together.